Thank you, Lenias, first and foremost for the introduction, and good day, good evening to you as well as all our participants. Um, so before I even begin with my reflections, could I please just have a show of hands with regards to who was present for the session that we had with Dr. Iluyomade? Um, just so that I know whether I'm speaking to people who participated in the last session or we're speaking to new participants. You can just raise your hand or react. Okay, so I see David was there for that session. Um, are the rest of us new participants? So if you're not there, maybe react with the waving or the clapping emoji, just so that I see. Okay, I see Snetemba is sending the clapping emoji. Let me just give a minute for everyone else to show before we begin with our reflection. Okay, so it looks like we have a mix of people who may have attended or who may have not. But essentially, as Lenias earlier on introduced, the last session that we had was with Dr. Martins Iluyomade, who is the Director of Investigation and Enforcement at Nigeria's National Agency for Food and Drug Administration and Control, also known as NAFDAC. And I don't just want us to recap the content of what was said, but to also reflect on some of my key personal takeaways. Because if we're being honest, that session challenged some deeply held assumptions that a lot of us hold, and it also initiated important conversations on what exactly is meant by patient safety. So if I was to begin, one of the key takeaways that I had, and I think Lenias, you can also agree with me, actually came from one of our participants. Her name is Maria Madenyi, and I quote, she said, "I used to think that a medicine is safe as long as it has a NAFDAC number, and I learned how wrong that assumption can be." Just by show of hands, how many of us have previously assumed that, a medicine that is registered by a regulatory authority is deemed to be safe? You can just thumbs up if that's an assumption that you've held before, that a registered or a regulated product is safe. Okay, so I see that there's thumbs that are coming up. So I think that's really a reflection that a lot of us can relate to. But what we've been taught in terms of looking out for signs, be it registration numbers, labels, packaging, or stamp of approval as proof of safety needs to be questioned. Because, a medicine passing through a checkpoint of regulatory approval and it getting a marketing authorization does not mean that the job is done. So what we uncovered together and what the last session taught us to question is that medicine safety does not necessarily just work like that, right? So medicine safety is not a one-time check. It is not a non-faltering label, and it's not a guarantee that a medicine will always be safe, because medicine safety is a process that happens on a continuum. And a lot of the times, it's also a fragile process that can be compromised along the different stages of a medicine's life cycle, as well as the different stages that we've got within the supply chain, right? So that was a key takeaway for me personally. But one of the biggest shifts from the last session was also realizing that a medicine's journey does not end at manufacturing. And in fact, it usually begins there, right? Because if we think about it, manufacturing is normally one of the better regulated parts of the convoluted supply chains that we've got. So from the moment that a medicine leaves the manufacturer, it goes through multiple hands and multiple environments. It involves passing through multiple storage facilities, multiple transportation systems, multiple distribution channels, and multiple pharmacies, clinics, and informal markets before it gets to the patient. So at every single one of those points, there is a possibility for something to go wrong. And unfortunately, our lived experience also tells us that there's a lot of things that go wrong. Just by show of hands, how many of us can relate to things going wrong after manufacturing? So I'm sure that there's some of you who work in community pharmacies, some of you work for wholesalers, perhaps distributors. Can you guys relate? You can just put a thumbs up. Okay, I see Yaz is raising her hand. I see David's hand is also raised. So I think we can all relate that every single life cycle point and also every point at the supply chain does create room for medicines to be unsafe, right? So it's important for us to realize because a medicine can be perfectly made. It can, be GMP compliant and follow, all the ticks, but it can still become unsafe because it was stored at the wrong temperature and humidity conditions. It was transported poorly. It was mishandled by people. It was distributed through unregulated channels. It expired because there was poor forecasting, because there was a lack of transportation, or it was held up at customs. And in some cases, also because it was being prescribed, dispensed, and administered wrongly. So this is important because it changes the question from, was this medicine approved, to what happens to this medicine before and as it reaches the patient. Because like I mentioned earlier on, all of these stages create a loophole that actually leave room for compromised safety. Another important shift for me was expanding on how we define unsafe medicines. I think a lot of the times there's a tendency to equate unsafe medicines with counterfeited medicines. Um, what is you guys' experience in the different settings that you're practicing in? Normally, when we refer to unsafe medicines, does that refer to counterfeited medicine in your setting? If that applies, once again, you can just thumbs up. Okay, I see Yaz is raising her hand up again. I think in a lot of our settings, we equate unsafe medicines with counterfeited or fake drugs, right? But that's usually not the case because unsafe medicines could also be substandard products. They could be falsely labeled products. They could be unregistered medicines, or sometimes even legitimate medicines that have been compromised along the way, as I've stated earlier on, right? So it's important for us to not only focus on the debate of fake versus real, because that actually misses the bigger issue. And we need to focus also on the system that exists behind these medicines, right? And the reason why this is important is that unsafe medicines are not always a result of bad people who are doing bad things. Sometimes they're just the result of weak systems. And when we talk about weak systems, we're talking about unregulated markets. We're talking about poor law enforcement. And I'm happy because Dr. Iluyomade's presentation, highlighted the importance of law enforcement as well. It's referring to limited traceability. I remember we had a colleague who also was working on technologies that deal with tracing batches of medicines and working on traceability. And it deals with gaps that we've got in oversight, right? So when all of these systems are weak, risk shows up. And risk doesn't always show up loudly. Sometimes it enters quietly. It becomes normalized, and a lot of the times it can spread and it can compromise safety. And the consequence of this is very important. It's not just theoretical, but it is in practical things that we get to see every day. And some of these things include treatments that don't work, a rise in antimicrobial resistance, patients who keep returning again and again to hospital despite adhering to their course of treatment, complications that come from adverse drug reactions, and in the worst cases, even death, right? So they are very much consequential, and they are things that actually affect patient outcomes and lives. So we're not just talking about products, but we're talking about patient outcomes and lives. And the next point is probably going to make some of us uncomfortable. I recall having this conversation with Lenias as well. Some of us think that we are exempt from unsafe medicines because of where we purchase our medications and where we access our healthcare, right? Just by show of hands, how many of us equate shopping at larger private chain pharmacies and private hospitals with access to safe medicines? If you guys relate, you can just thumbs up, or if that's an assumption that exists widely within your communities, you can just raise your hand up. because in some of our communities, there is an assumption that going to elite facilities, private sector hospitals, chain pharmacies, that would actually protect us from unsafe medicines, right? So that's also an assumption that's held. But it doesn't account for something that's important, which is, remember, medicines need to be manufactured in safe facilities, safe manufacturers. So even if a medicine is purchased from a trusted source, like your private hospital or your big chain pharmacies, you're not automatically guaranteed to be safe, right? Because sourcing is important. And once there has been a break in one point within the supply chain, that automatically risks everything else. So the end point doesn't necessarily actually protect you from unsafe medicines, right? So it's not just enough to trust the endpoints, but we also have to strengthen the entire system behind it, because if the source is compromised, so is every other point of the supply chain. So this means we need better traceability, stronger accountability, and tighter control across the supply chain. And as we prepare to wrap up, the last point is on awareness, right? And the key takeaway from that session was that awareness matters. And it doesn't just matter, but it matters a lot. Because unsafe medicines don't just circulate because our systems are weak. They also circulate because people don't always know the risks or don't have access to affordable and better options. So whenever we create awareness, we're doing a few things. Awareness helps us to help people actually to make better and safer choices. It helps our professionals to spot the risk earlier on, and it also creates demand for better systems. So in many ways, awareness is where protection begins, and that's why we call it the first line of defense. So unsafe medicines persist only because, not only because of supply chain failures, but because many people also don't know what to look out for. And so by enabling people to actually be aware, we are truly creating the first line of defense. So if I had to actually summarize the last session in one line, it would be that medicine safety is not a one-point check, but it's a continuous responsibility. And yes, a lot of the times regulators are responsible for that responsibility, but it's also up to us as healthcare professionals, as supply chain actors, as policymakers, and as communities. So the reality is that there is a shared public health responsibility, and we all have a role to play in it. So before I wrap up my session, I just want to leave you guys all with 2 questions. And you can answer these questions right now if you're able to come up with the answer quickly, or you might also type it in the chat as we go along with today's session. But the first question is, if medicine safety can break down at so many points within the life cycle and within the supply chain, where do you fit into ensuring patient safety? So I want you guys to have a personal reflection and to tell us, what do you do and where do you fit in terms of ensuring medicine safety? And then the second question is, please just tell us a little bit about what you have been doing up to now in order to ensure patient safety. And if there's anything that you'd like to change following the last webinar and the upcoming ones, tell us in terms of what you are hoping to do differently after attending the last webinar that we had. So both questions are a little bit reflective, but we want to know in terms of where you fit in within your current role in terms of ensuring patient safety. And secondly, tell us in terms of what you intend to change after the last session that we had. So I think let me not take up too much time. I just want everyone to hold on to these questions and to answer them. You guys can raise your hand if you've got the responses. And without further ado, I just want to say thank you for listening, and I'll hand it back over to Lenias.